The lateral slide function on the OT1000 series tables will open the image window for surgeon exposure to achieve unobstructed imaging in most cases. You may translate the tabletop through the hand control or button on the side of the table to improve surgical access to the patient and achieve greater imaging of the site. It's important to note that lateral slide is a manual function. However, tabletop must be unlatched and tilt leveled before manual buttons are available for use. First, ensure head section is level. Next, verify table batteries are charged and table is on. If the patient is on the table, ensure the patient is properly positioned. For additional information, refer to the OT1000 series setup guide. Now ensure level tilt LED is on. If not, level tilt the table and the LED will illuminate. Next, press unlatch manual button located on either side of tabletop, or unlatch button on primary hand control, and push tabletop laterally to position. The table can translate 4 inches left or right from center and will lock when position is achieved. Following these steps will provide you with the proper use of the lateral slide function on the OT1000 series tables.